everyone, so in this video we are going to study the anticholinergic agents. So anticholinergic agents are going to be divided into two classes, the antimuscarinic and antinicotinic agents. Now we're gonna do the antimuscarinic agent in like explanatory way over here, but first let's do the antinicotinic agent as well. So in antinicotinic agents we're gonna have the ganglionic blockers and neuromuscular blockers. In ganglionic blockers we're gonna have the trimethophan, bupropion, and vernicillin, and there was one more drug, nicotine. Yeah, there are four drugs in ganglionic blockers: trimethophan, vernicillin, nicotine, and one more. Okay, now we're gonna do the antimuscarinic agents. So in antimuscarinic agents are going to have mainly two classes: the natural alkaloids and the semi-synthetic and synthetic antimuscarinic agents. Let me zoom it a bit. Okay. Now, the natural alkaloids are atropine and scopolamine. Scopolamine is also called hyoscine. And in semi-synthetic and synthetic antimuscarinic agent, there are six classes. For remembering that, I remember the mnemonic MAP4. So MAP, and on P there is 4. So M is mydriatic, S is A is antispasmodic, P is peptic ulcer, then other P is for pulmonary diseases, then other P for the Parkinson, and other P for pre-anesthetic medication. Now in mydriatics we're gonna have the hematropine, cyclopentolate, and tropicamate. In antispasmodic we're gonna have the dicyclomine. Then in peptic ulcer we're gonna have pyrazipine, telanzapine. And Parkinson we're gonna have the benzhexol and benztropine. So it's written, all of them are written over here. And Parkinson is benzhexol and benztropine. And pre-anesthetic medication glycopyrrolate. And I'm done with the pulmonary ipratropium bromide and thiotropium bromide. The ipratropium bromide is mechanism of action is 6 hours, and thiotropium bromide is 24 hours. Now we're gonna do the atropine. So atropine is a tertiary amine, so it can cross the blood-brain barrier. Okay, so for remembering the actions of the atropine, the atropine action are opposite to the action of the acetylcholine. Okay, so just look at this diagram and we will be able to do all the actions very easily. Okay, first we as I told you before that I'm gonna go from eye to the toe. Okay, in eye it is going to cause three things: passive mydriasis, cycloplegia, and loss of corneal loss of light reflex. Three things: passive mydriasis, cycloplegia, and loss of light reflex. First thing, in lungs it is going to cause bronchodilatations, and as well as reduces the bronchial secretion. Okay, then in heart it will reduce heart activity, it will increase the heart activity, like tachycardia, heart rate will be increased, force of contraction will be increased, AV conduction will be increased. Okay. Now in GIT it will reduce the tone, it will reduce the peristalsis, it will increase the tone of the sphincter. Because of that the motility will be reduced. In the bladder it will cause a relaxation of the reducer muscle as well as contraction of the trigons, so there won't be any urination. Okay, in CNS it is going to control the tremors and Parkinson. And apart from that, there's gonna be reduces the exocrine secretions as well. Okay. Now, I already told you that in eye it is going to cause passive mydriasis and cyclopegia. That's it. Now, that's really important. Like the difference between the atropine and epinephrine. Okay, so the atropine causes passive mydriasis and it causes active mydriasis. It is going to be causing cycloplegia. It does not cause cycloplegia. It causes loss of light reflex. It does not cause that. It is going to cause the glaucoma, but it does not cause the glaucoma. On the other hand, it treats the glaucoma. Instead, it treats the glaucoma. Okay. Now, the uses, I already did it, so there's no need to do it again. There's only one thing that I has to tell you that it's really important, and it come in paper as well, that epratropium and thiotropium bromide. Epratropium bromide action is 6 hours and thiotropium is 24 hours. Now epratropium and thiotropium bromide causes bronchodilatations as well as reduces the bronchial secretion, so that's why it is used in asthma. But the bad thing is that it does not have any effect in the mucociliary clearance. Okay, it does not have any effect on the mucociliary clearance. That's it. Now we are gonna do the side effects are really easy to find out. Just makes the effects uses affects too much, so it will cause the side effects, which are really easy. It's gonna be really easy to find out those. Okay, we're gonna do the atropine poisoning, which is also called the belladonna poisoning. For the poisoning, first we're gonna hospitalize the patient. We will do the gastric lavage. We will makes the person, like, we will do the sponging of the patient to reduce his the body temperature, because in atropine poisoning the body temperature also increases, as well as we will give diazepam for reducing the convulsion. Okay, and on the other hand, we're gonna also give the antidote, which is the physostigmine, 1 to 4 mg. Okay, intravenously, slowly, which I already told you that it's given IV slowly, and why it's given slowly, so the bradycardia don't happen. Okay, and that's it. Now we're gonna do the scopolamine. So scopolamine is the drug, it is a semi-synthetic and the synthetic one. Okay, which we already did it. No, 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 no. It is the natural one. It is the natural one. Look, it is a natural alkaloid along with the atropine. Okay, scopolamine is a drug which we use mainly for the motion sickness. Okay, so it is present in two forms, either oral form or either the transdermal patches are present. So in oral form we give in oral form we give 0.2 mg at least half an hour before the journey, and in transdermal patches we give at least we apply the transdermal patch at least 4 to 5 hour before the journey, and the effect of this drug is about 3 to 3 days, which is 72 hours. Okay, now the side effect of scopolamine are sedations and dryness of mouth. Okay, now if we talk about the action, how where it act, and normally what happens, for example, if the body is so much in motion, for example, if someone goes to the hilly areas, so the body is so much in motion, or even when someone is riding some kind of children's ride, the the anything, it could be anything, fast car, it could be like a merry-go-round or whatever it is. So the motion, because of the motion, the vestibular apparatus gets stimulated, and the vestibular apparatus contains the M and H receptors, which is going to cause afferent signals to the cerebellum. From cerebellum the signals goes to the vomiting center, and the person start vomiting. But when we give scopolamine, so scopolamine act on the vestibular operators which contain M and H receptors, and which is going to uh, block these receptors, and because of that there's not going to be afferent signal to the cerebellum and then to the vomiting center. Okay, yeah, that's pretty clear. Now, drug interactions of anticholinergic are just remember HTP, H1 blockers, tricyclic antidepressant, and phenothiazine have atropine-like action, hence potentiate the effect of anticholinergic side effects. Okay, H1 blocker, tricyclic antidepressant, and phenothiazine has atropine-like action, so it can potentiate the effect of anticholinergic effect. And atropine also delays the gastric emptying, so because of this, it increases the absorption of many drugs. It reduces the bioavailability of levodopa, but increases the bioavailability of certain like tetracycline and dioxin, etc. Okay. Now in ganglionic blockers, I already told you that we are going to have nicotine, bupropion, vernicillin, and trimethophan. Bupropion and vernicillin we use for smoking cessation, and bupropion mechanism of action is that it inhibits the norepinephrine and dopamine reuptake and is used for smoking cessation. Vernicillin decreases the craving and withdrawal symptoms during smoking cessation. Okay, and vernicillin is a partial agonist of nicotine receptor. And the last drug is the trimethoprim. Trimethoprim is the short-acting ganglionic blocker that must be given IV infusion, and and the main function of the trimethoprim is that it is used to control the hypotension during neurosurgery.